I am Santisha Walker, your nurse advocate. I am a registered nurse and a certified wellness coach. Today, I would like to focus on 5 ways you can help your nurse advocate for you. Now, as you know, my goal is to provide you with the necessary tools that you could utilize to help you better communicate and confidently communicate with your nurses and your doctors. Now, I want you to know that nurses are your advocates. We do so much more than that, but one of the things we do is we advocate for you, okay? We are not the physician's assistant. There's an actual separate profession for that called PAs, and we are not the physician's subordinates, and we are not their secretary, okay? We are our own profession as nurses. We have our own liabilities, our own mandates, our own regulatory bodies, and we operate according to the Nurse Practice Act. One of the things that we do under our scope of practice is we advocate, okay? So we are expected to do that as your nurses. I want you to keep in mind that nurses are there to serve as your mouthpiece. We are your advocates when you are absent. This is in the hospital, this is in urgent care, doctor's offices, in-home care, outpatient, pre-surgery, whatever the case may be. Now, I want you to know that since you're going to be tapping into nurses to advocate for you, it is your responsibility to do your part and speak up and provide the information that's needed, okay? So let's dive into 5 ways you can help your nurses advocate for you. Number 1, be honest as you share healthcare related information, okay? Anytime during the intake assessment, whether it be in the hospital, whether it be pre-surgery, home care, community care, whatever the case may be, make sure you are providing accurate, timely, complete information so that your nurses can input that information and have that conversation with your care team. Number 2, inform your nurse if you're feeling nervous or anxious about discussing any topic with your physician or your provider. This is going to allow nurses to either keep this information in mind when they are rounding and communicating with your physician or your physician's assistant or your care team, or they will bring this information directly to them. Number 3, let your nurse know if you want your perspective, your opinion, your thoughts to be shared in your absence. And I want you guys to not be shy about this. Literally say, hey, nurse, so-and-so, I want this information to be shared, by the way, when you speak with my doctor, blah, blah, blah. Okay, so have that real conversation with them. It is your job to express that. And even if you don't express it, nurses will advocate for you. But I want you guys to take charge and be confident just in case that nurse does not share that information. Number 4, inform your nurse if you have any questions or need any clarification about information that your physician or your care team has provided to you, okay? The nurse will either sum up that information for your understanding, or the nurse will bring in the physician or the provider to sum up that information. There's some information legally that nurses cannot discuss with you all, but however, the nurse can advocate to get that information clarified. But you must do your part and you must speak up. Number 5, let the nurse know if you need any additional resources or guidance that's going to help you when you actually leave and you go back home, okay? So the nurse is kind of like the quarterback of your care. And so they have access to all the interdisciplinary team, multidisciplinary team that's a part of your care team, okay? But it's your responsibility to confirm if you need any additional information, and the nurse will then pull in different aspects of your care team. The case manager is there from the beginning. However, the nurse can have that conversation with the case manager, the social worker, the therapies, other specialists and physicians so that you can get what you need. These are very simple ways you can begin to help your nurse advocate for you. So let's recap. Number 1, be honest as you share information with your nurse. Number 2, inform your nurse if you're feeling anxious or nervous about any topic conversation with the physician. Number 3, let your nurse know if you want information that you've shared with them or your perspective to be shared with your care team in your absence. Number 4, inform your nurse if you have any questions about any information previously shared by your physician or your care team. Number 5, let the nurse know if there is any additional guidance or resources that's needed for you to continue with your care plan outside of the healthcare setting. Now, if for some reason you come across a nurse who is not willing to advocate for you for whatever reason, you do have a right to request another nurse, okay? I will say you need to do your part. You need to be cooperative. You need to make sure you're thoroughly communicating, give that nurse what they need to do their job. But if you are trying to get something pushed through or done and they are not willing to advocate, you can request another nurse. You have a right to do so. Just keep in mind that when you're communicating with your nurse and you're going forward with advocating for yourself, this is going to make you a better advocate just in case you don't have a nurse present for you one day. And so you're going to know how to speak up for yourself and what kind of conversations to have with your care team. If you need any additional information or resources when it comes to advocating for yourself, be sure you tap into the advocacy ebook and guide that's in the caption below. You can access it on demand. Be sure you guys subscribe because I have a lot of great information that's coming your way, and be sure you share this video with others that you feel could benefit. Talk soon. Bye.